Good evening, everyone, and welcome to our Sowing Seeds panel. This panel is entitled Residency 101, given the season of Match Week. And today we have two panelists here today to talk to us about their residency experiences and their journeys moving through residency. So, to introduce our panelists, our first panelist is Dr. Uchenna Anani. She's an associate professor of pediatrics in the Division of Neonatology at Vanderbilt University Medical Center, where she also serves as core faculty in the Center of Biomedical Ethics and Society and assistant program director for the Vanderbilt Pediatrics Residency Program. She earned her medical degree from Howard University College of Medicine, completed her pediatric residency training at the University of Michigan, and fellowship training in neonatal perinatal medicine with distinction in biomedical ethics at Monroe Carroll Jr. Children's Hospital at Vanderbilt. Dr. Anani's scholarship sits at the intersection of neonatal bioethics, equity, and parent-provider communication. Using qualitative and mixed methods research, her work examines how bias and structural inequities influence counseling and treatment decision-making in the NICU and how trauma-informed communication can strengthen ethical clinical care. Nationally, she serves on the leadership committee of the Neonatal Justice Collaborative and mentors several medical students, residents, and fellows in bioethics and health equity scholarship. Outside of work, she enjoys Peloton rides, Audible audiobooks, exploring new restaurants, and spending time with her rambunctious twin boys, Joseph and Jacob, and her husband, Dr. Love Anani, an emergency medicine physician and medical director at HCA TriStar Northcrest and former SNMA professional board member. Welcome, Dr. Anani.
Thank you.
And last but certainly not least, we have Dr. Stephen Bradley, who's an anesthesiologist, critical care medicine physician, and certified healthcare ethics consultant. He completed residency and fellowship at the University of Chicago Medical Center and 2 years of training at the McLean Center of Clinical Medical Ethics. A Navy veteran, he has research interests in leadership, perioperative healthcare disparities, ethical implementation of AI in healthcare, and complex medical decision-making. He currently practices in Tampa, Florida, and is an assistant medical director for his anesthesia group. Welcome, Dr. Bradley. And so, just to start, what factors helped the both of you decide on your specialty, and when did you know that it was the right fit for you? And anyone can just hop in.
I can start. Interesting enough, went into medical school knowing that I wanted to do pediatrics from the start. My mother is a NICU nurse, or recently retired NICU nurse. And so my exposure to healthcare was, times in which I would, we might drop her off at a hospital and I get a peek into the nursery and see babies and isolates and blue lights. And so when I kind of gravitated towards healthcare and medicine as my interest, I knew instantly I wanted to do pediatrics. I knew instantly I wanted to take care of babies. And luckily, when I went to medical school, I had really great mentors, one of which was a neonatologist and really kind of exposed me to the field really early on. And despite keeping an open mind in other ways, like I stuck with it, and it always aligned well with me. And so I really enjoyed being able to take care of pediatric patients, being a part of families. And interesting enough, I think in neonatology, even though it's an intensive care setting, you actually do get to have a lot of continuity with families, just because they're, some of our patients are there for weeks to months or even longer. And so you really get to bond with those families and really help them kind of navigate a very challenging time in their life and ultimately be able to get to the point where they're able to take their little baby home. And that's a really amazing feeling. And so I've just always gravitated to that space and have never looked back.
I love that.
Yeah, for me, how I chose my specialty. So I'm first generation in healthcare. So this was really all new experiences for me. When I got to medical school, I thought I wanted to do orthopedic surgery because I had some shadowing experience with a physical therapist. And I quickly realized that wasn't the specialty for me, like month 2. And I was kind of lost for the next year. And even into second year, I didn't know what specialty I wanted to go into. I figured when I started third year, I would just see what really spoke to me. I chose anesthesia as a plan B because I had a good friend and classmate who raved about anesthesia, said it was the best specialty ever. You get to work in pajamas all day. And that was a direct quote. And so I had that as a plan B. Figured I'd rotate through everything and see what I liked. I really liked surgery, and I realized, especially rotating at Howard, I'm class of 2014, so I was just behind the Ananis. I realized I really enjoyed working in the ICU. And so I was planning on becoming a trauma surgeon and doing critical care medicine. And then I found out that you could do a critical care fellowship after completing training in anesthesia. So I kind of put both of those interests together. That being said, from the anesthesia perspective, you don't get a very accurate experience of what the specialty is as a medical student. And during our first year of residency, we usually do kind of an internship that's not all anesthesia. And I realized halfway through that intern year, I was like, whoa, I don't even know if I like anesthesia because I haven't actually done this specialty, right? In emergency medicine, you rotate and do emergency medicine stuff, and same with internal medicine. But for anesthesia, and there's a couple probably niche specialties that you don't necessarily get that full experience with as a rotating student. And so it wasn't until I was in the OR as an anesthesia resident, as a PGY2, and having that hands-on experience that I realized like this is the right fit for me. All the procedures, working in the ICU, that's where it all really came together.
Awesome. Thank you both for sharing your stories. Very different ends of the spectrum, but everything works out the way it's supposed to. So talk to me. Since this is Residency 101, let's start from the beginning, match day. Where were you emotionally right after match day? And what's something you wish you had known prior or in that moment, I'll say?
I'll take this one. I'll start with this one. Man, I was elated because you've worked so hard for something. And for me, people worry about your first match, second match options, whatever the case. I just knew I had a job and that I hadn't wasted not that it's a waste, but I hadn't taken the last 4 years and, had to reapply or had to change something. I felt like it was worth something. Like I was going on to the next phase of this journey in medicine. So I was just elated. I mean, being at Howard, we had a fantastic time, a lot of supportive classmates. What I guess I really didn't understand at the time, I think I put a lot of weight into having my first choice in the match. And looking back, I realized like what's really important is just getting into the specialty that you want and going somewhere that you will receive good training. Every residency program is, or if your residency program is ACGME accredited, 90% of those programs are going to give you good training in whatever the specialty is. So I think looking back, that there's a little bit of undue pressure that didn't necessarily need to be there.
I will also say I was extremely excited, elated. Me and my husband couples matched. So it was quite stressful, anxiety provoking to try to, and he matched into emergency medicine, which at the time, and I think still is like relatively competitive. But it was, I don't know, it was just like this euphoria of like, yes, like we finally like overcame it all, like similar to what Dr. Bradley said, like just knowing all the hard work that you put into it, and knowing that you're able to kind of move on in that journey alongside that partner with you, was just, the cherry on top. And so it was a really, really amazing experience. We did not get our first choice. We got our second. But to be very honest, we were fine with that. Like we just wanted to be together. Our programs actually were not in the same city. So that was something that was a little bit deterrent. So like our jobs were probably about, I want to say like 2 hours, 2.5 hours apart. And so we ended up, so I was pretty anxious about how are we going to do this, but we were able to find a place in the middle, commute out. that was a little bit challenging, but I guess looking back at it, just recognizing that as long as you have the support of one another, like things will work out, and just kind of trusting the process. But we were ecstatic. Like it was just like, thank God it worked out.
Yeah, definitely. Now, what are some common feelings maybe that you experienced, or generally speaking, that new interns experience, whether it's more excitement, anxiety, imposter syndrome, whatever that may be? What's something you experience, or generally speaking, new interns experience?
I will start off. I will say intern year was such a learning curve for me. Um, I had gone on different like clinical rotations, away rotations, but again, you only get like a snapshot of like what your field is going to look like. And so going into that rigor of, 6 a.m. start time to 5 p.m. in the evening. And then I had like a 45-minute to hour commute, like both ways, and trying to optimize learning at home and sleep. So it was a lot. And I would say I definitely dealt with imposter syndrome for sure. Definitely feeling like I wasn't at the same, like moving at the same pace as my peers, really doubting myself in terms of the way I was like presenting patients or kind of thinking critically. And I think one of the things I had to learn and kind of eventually kind of learn and kind of know myself is that like you have all the skills to be a successful physician, successful pediatrician. You are trained well. You have everything in your power to be able to succeed. And sometimes your worst critic is yourself sometimes, right? I think I started to realize as I got to know some of my co-residents that a lot of us were going through that feeling, right? And so I wasn't alone in that feeling of imposter syndrome or just feeling doubtful or feeling anxious about X, Y, and Z. And so I think being able to lean in on my colleagues as we're all going through this journey of learning how to be a doctor in real time and how to grow and kind of be I guess what's the word? Like just understanding that like we're continuing to grow each and every day. We're lifelong learners in this space of medicine. And so being able to trust my colleagues and be able to share that, and also start to believe in myself as I got a little bit of confidence back each and every day, week, month rotation. But offering myself just grace was huge.
Yeah, it's definitely, I mean, imposter syndrome is a nice kind of catch-all phrase for it. And there's so many different factors to that because clearly you know enough to get out of medical school, you passed your step exams, you've successfully matched. But for me, that stuff starts to show up in weird ways. Like you know what you know until you move to a different environment, a different part of the country. The terminology starts to change. The hospital you're working at, the antibiotics that you use, Bank South and Flagyl at one hospital where you trained, it's a different go-to selection of antibiotics at that hospital. And it's just what they do. And I'm sure it has to do with community exposure and whatnot, but you learn things a specific way. Just that, like there was that transition from what you learned as a first and second year into the clinical practice, and everything didn't work the way it did in the textbooks. You know medicine, but it may work differently at this new hospital that you just joined. You start hearing different words for medication. Like I knew of Flexeril, which is I think cyclobenzaprine, and then the hospital I was at, all of a sudden they started using Robaxin. I was like, what in the world is Robaxin? I never heard of that medication before. It's a different class, and it's just what they used. Some places have IV Tylenol, some places don't. And it's these weird little one-offs that they can catch you unawares. And being in a minority in medicine, sometimes those are assumed to be knowledge gaps. So it's not even that you were an imposter. It's just like you just didn't know this thing because it's not something you're exposed to. And now it's potentially factoring in people's judgment or assessment of your clinical skills and knowledge. You're in a new city. You've got to learn how to commute from one place to another. You're in a new hospital with the floors, the way they're laid out, and how do you round efficiently. You know all 10 of the patients on your service, but you're running around in laps and doubling back and forth because you don't know how to physically get to those rooms and round. So I think those were, as it gets into that feeling of imposter syndrome, or like the things you don't know, that's what I couldn't really have prepared for.
Mm. Yeah, thank you both for sharing. I think you both bring up excellent points. One, Dr. Nani, about community and recognizing that 9 times out of 10, you're not the only one feeling the way you feel. But also, Dr. Bradley, you mentioned, navigating a new space and the nuances of each space. It's not that you're lacking your medical knowledge, it's that you don't have the same insight about the hospital and the way things work within. So you guys definitely bring up good points. Thank you for sharing. My next question for you is, what should newly matched medical students be doing in the 1 to 2 months before residency begins?
Yeah, I can start. Absolutely relaxing. I mean, people say this, and I know they said this to me, and I was like, no, I'm going to be different, and I'm going to study. I think that lasted for like 2 days. But you should really enjoy this time. You know, you're coming out of a phase in your life with your medical school classmates. Um, Enjoy that time with those people. Continue to nurture and build those relationships. Start to plan for the move. You got to figure out, how are you going to pay for this? Where are you going to live? So sit down and have a timeline of when you're going to be able to go out and visit and go apartment hunting and start reaching out to contacts and getting prepared for that transition. Because if you have a smoother transition, that can better set you up to succeed in residency and hit the ground running.
Yeah, I concur. I would definitely celebrate the win of match, celebrate the fact that you have, successfully navigated 4 years of or even more, depending on what pathways you had, of medical school, and that you're here at this moment. I have also heard, individuals who are like, oh, I want to make sure I'm prepared. I'm going to study, study ahead of time for step 3 or whatnot. And honestly, if you I never want to tell people exactly what to do. Like whatever is going to bring you peace in your heart, do. If it brings you a lot of anxiety not to feel like you're reviewing something or studying for, step 3 because you want to be prepared and you feel like that's the next best step for you, then by all means do so. But also take a moment to just pause, relax, rest. Rest is really important. And really just celebrate the excitement, the growth of finishing medical school and moving on to the next step. I will say from a professionalism standpoint, it is important that you make sure you are very responsive to your emails from your program. And I agree with Dr. Bradley in terms of a timeline when it comes to the move, when it comes to all of the paperwork that you have to do, licensure, paperwork, you really want to be on time with that because that's serious. You want to get your DEA, you want to get your medical license, whatever that may be in what state. You want to make sure you get your call schedule in, all the things. And so all that kind of what's the word I'm looking for? I'm at a loss for words. But all that paperwork that you need to do to start your job, you want to make sure that you're doing that in an efficient manner. And not getting behind on that. So that's my one kind of soapbox from professionalism.
Administrative task, because it's hard to describe that anxiety that you're going to be feeling when you were late submitting paperwork and you're worried about not starting on time and you've already got to hear from your program director, well, why didn't you do this, that, or the other? Yeah, get ahead of it.
Absolutely.
Thank you all for your insight. And so something you both touched on a little bit is studying. And for my question specifically is about step 3. When is a good time to start studying for step 3? Is it before residency begins? If not, how did you manage, acclimating to this new program, new city, new people, new time constraints, as you mentioned, Dr. Anani, but also studying for step 3 and making sure that you pass?
So I will say one of step 3, I took actually during my second year of residency. And that was because most of the trainees, most of the residents at my program, that typically was kind of the timeline, was to take it during your second year. There were a couple of folks that took it first year, but the majority of folks took it second year. And that was just because of the structure of our residency program. I will say first year was very inpatient heavy, like 95% inpatient. So you really didn't have we didn't have elective time really, not a whole lot of downtime outside of your vacation time. So it would have been pretty hard to study effectively, at least for me. Second year was kind of the opposite, where there was a lot of outpatient time. And so you had weekends off, you had more, less kind of like stringent like work schedule. So there was a lot more flexibility to allow for myself to study. And so I took it, I think, like fall of my second year. I think if you have a question about whether or not when you should take your step 3, maybe like reaching out to like your program director to get like ask like what is the typical timeline for residents and when they take their step 3. I mean, the program I'm at, I know residents will take it during their 3rd year. So it just really depends on what your goals are, and also just getting a sense of like what is the kind of culture and the structure of the program, and how does that align with what's best for you in terms of how you study and prepare. Adjusting to a new environment was huge. I will say it was definitely, I used the word cultural like shock, but it was a transition moving from DC to like Michigan. The winters were tough for sure. And I definitely acclimated, or I learned about seasonal affective disorder. And so like essentially like I knew my mood changed when the winters came in Michigan. And so I did my best to like try to prioritize my wellness as best as I could. For me and my husband, like making sure that we just took time for one another, whether it was, movie nights, at home or at the movie theaters if we had the, night off, or, my physical health, taking time to work out when I had the availability, things like that, or just times to just pause and just rest, and do whatever I needed to do to like get my mind right. So I made sure to do that. But then also just, again, I say community because it's so huge. I will say a lot of my community was probably not necessarily in my residency program, but probably outside of my residency program, connecting with folks that I knew through my husband, being with my partner, and also still connecting with family as well. But definitely also bonding with my co-residents, when we're on service together, kind of that trauma bonding of, here we are in the trenches working together and getting to know one another and sharing this, this shared task of taking care of these patients together. So I think for me, like making sure that I just felt like I was connected in some way to support my mental, physical, emotional well-being was very huge.
Mm-hmm.
Yeah, the first thing I would say for when you take step 3 is definitely, as Dr. Nani mentioned, check with your program. Some residency programs will have an earlier date that they expect or require folks to have their step 1 done, some as early as like by the end of your first year. So know what your residency program expects. For some people, depending on your subspecialty, OB, peds, you may not, some people just want to get it over with so they can quote unquote forget that medicine that they don't really practice that much anymore, for lack of a better way of phrasing that. I wanted to get it done as quickly as possible just so I could just move on with my life. And I'm painfully honest. So here's what happened with me. I took a test in August of my intern year. I was in the middle of a very toxic relationship. I think a couple weeks before I was on night float. My partner at the time, she would like borrow my car to get to work, and that left me to take the train from the south side of Chicago to Evanston, which was like an hour drive or hour train ride. And I'm on the train sitting for step 3, exhausted. It was like 2 of the roughest weeks of my time in residency. And I share this because life doesn't stop just because you're in residency. You're going to have family problems, you're going to have relationship issues. You're probably going to make some bad decisions like I did. So I took step 3, studying all that I could in the middle of night float and the very brutal schedule. And I passed by, I think, 2 or 3 points. So it worked out. Would I do it again that way? Probably not, because I was very close to having to retake that test. And pay that fee again. So definitely carve out an appropriate amount of time. Know that sometimes life is going to happen, um, and set yourself up for success as best you can.
Yeah. Thank you both for sharing your insight. And Dr. Bradley, I'm from Chicago, so I know that train ride was not fun. So my next question is twofold. What are the biggest challenges during the transition from student to intern, and how do the expectations differ from medical student to resident?
So I would say the biggest transition, at least for me, was really kind of transitioning into the practical aspect of being a clinician and also a learner at the same time. So like I was in my mind, I was a fairly good studier, like when I was able to have like this dedicated amount of like hours and time, like sit at a desk, review, um, world questions, review my texts, all this stuff. But it was actually quite challenging for me, particularly in that intern year. That's why it was such a huge learning curve for me, adapting to this idea of like I'm learning as I go along, I'm learning on the job. And that was a shift, and I think that's something that you have to be mindful of and kind of know yourself too, like how do you best learn is going to be really important, and like are there multiple different ways in which you can learn and how do you adapt to that clinical environment. And so for me, I had to quickly transition to I'm not going to always know everything, and that is totally fine. No one expects you to. That is the whole point of training. But my goal was really focusing on small wins of like, okay, I didn't quite get that presentation the way I wanted to, or I didn't quite know that answer. I'm going to make sure I work on that for like 5-10 minutes, tonight before I go to bed. I'm not gonna overexert myself and say I'm gonna be studying for like or overcommit myself and say I'm going to study for the next 30, 45 hour, an hour plus, because when I get home, I eat, I'm tired, I want to go to bed. So I tried to kind of create very small attainable tasks to like learn when I wasn't on rounds, I wasn't on service, to like learn a little bit about my patients, come back, try to make that change, that improvement, and go that and move in that direction. And I think focusing on those small wins, those small tasks was really huge for me. I've been battling a lot with this idea of like, rather than focusing on just gradual growth mindset and like excellence, I was really focused on like, I need to be perfect in this way. I need to, had very unattainable like goals. And so I think by transitioning that mindset to really just focusing on small tasks, I think that really helped me adapt to the learning on the job format of residency.
Mm-hmm.
Yeah, and I'll share. I'm not in graduate medical education at the moment, but when I had residents, I think the biggest thing that I wish somebody would have told me, since I could see it on the other side, and there's an acronym, I can't remember the acronym, but as a student transitioning to being an intern, resident, and on up the academic ranks, your attendings are looking for a transition from you being a gatherer of data, you're collecting vital signs, you're repeating that data. Then they expect you to start synthesizing that data. You take that heart rate, that blood pressure, and you're not just saying the patient's heart rate is 100, and the adult patient heart rate is 120, and their blood pressure is 90/60. Maybe in the middle of intern year, towards the beginning, or towards the end, you're saying the patient's tachycardic, hypotensive, based on their chest X-ray. I think this could be a pneumonia, this could be a serious response, or sepsis. And they're expecting you to start synthesizing that data and interpreting that data, and you're forming diagnosis. That's the change that they're looking. And nobody really set me down and told me this, but having to sit through and talk with residents who are just continuing to report facts. And they're telling me data, and I'm like, you're a junior resident, you should be telling me a diagnosis, right? That's what you studied all of medicine. Make a diagnosis. You may not know the answer because it's all incremental. You may not know the treatment, but at least getting the diagnosis, that's that next step in growth. And then as you progress, now you know the treatment based on this data. This is a diagnosis, and I think we should do this. And if you look at your arc, from being a medical student into intern year, into completing your residency training, I think that is a trajectory that your attendings are looking for. It can be very frustrating when you have people that are advanced in their training that are still leaning on just reporting data. They're not engaged mentally. They're not really critically thinking. And some attendings are better about coaching you through that. Some attendings are quick to just be frustrated and write you off, and it just goes in your eval. Maybe you have some senior residents that are going to take you under their wing and be able to help you grow into that diagnostician. These are kind of the things that may or may not happen in your residency, which is so important for panels like this, for people to say, be very mindful of, are you just reporting data, or are you critically thinking and using your very expensive medical education to make those diagnoses and improve?
Yeah, I'll co-sign that. I think the acronym you're referring to, I think it's RIME, like RIME. Yeah. So like reporting, interpreting, managing, and then I guess like towards the end, like being an expert in your space. And so like that's the other thing I will co-sign is like no one expects you to be able to do it all at once, right? Like they're looking for that growth. But I do agree, like your goal is to continually like demonstrate those milestones, and like in the intern year especially, like you want to transition out of being just the peer reporter, but to like, let me interpret, let me at least start. You may be wrong, and that's fine, because that's the whole point of residency, is to teach you and guide you, but they need to be able to see that process. And you're absolutely right. I think there's some faculty who are really great at coaching residents in that way, and there's some that may struggle themselves in terms of how to navigate that.
Yeah, thank you both for sharing. I think that was very insightful. And my next question is pretty much answered by what you all just said, but just wanted to ask in case you all have anything else to add. And I know it kind of varies by specialty oftentimes. But the next question is, what does being a good intern actually mean to your senior residents and to an attending?
I can let Dr. Donnie take a break. I'll take this one. Let's see. And I've been I think I was an intern in 2014, so maybe 8 years ago or so. But being a good intern, number one, like honesty. People have to be able to trust you. Whether that's saying, I don't know an answer, whether that is admitting to a mistake, no matter how big or small. People have to be able to trust you. You only have one time to make a good first impression. That's really what intern year is all about. You're making a lot of first impressions, and your senior residents, your attendings have to be able to trust that when you see that patient, you did a full physical exam, you listened to their lungs like you said in report. I'll tell a brief story. When I was rotating through emergency medicine as an intern, I saw a patient, a young college student. They had a headache or something, and I did the exam. I was like, "Oh, you just were on a flight from Spain. You got a crick in your neck because you slept wrong." And fired off the note template. It was fine. Well, then I saw, like, one day I got an email from the medical director of the ER, and they were looking for me like, "Oh, we want to talk to you about this patient." It turned out that patient, their parent was faculty at the institution, and long story short, they had an ear infection, but I documented a normal ear exam. Granted, it was a template in the note that I didn't change, but the otoscopes, they didn't even work. They were in the ER, right? Every ER, they were broken. You couldn't find an otoscope to save your life. So it was clear I did not do an ear exam. And I knew this guy didn't know who I was because I was just an anesthesia intern, and I hid from him for like the next 2 weeks I was in the ER. But nothing ever came from it. But it's something like that. It was very clear. It was just a clerical error. But it's not hard for people to know that you did or didn't do something. And once you have that reputation, it's very hard to get past it.
Yeah, no, I agree. I definitely also think that teamwork is huge. That's a huge pillar for me. I feel like for any, senior resident to be successful, they are dependent on the effort, the work, the team mindedness of their interns as well, in terms of helping to contribute to the team. And I think like similarly, the upper level or the resident helping and supporting their interns as well. And so having that team mindset of like, how can I help is really, really important. And I mean, some of that also stems from when you were a medical student during your third year and fourth year rotations, taking those same skills and bringing it forth here as an intern is really, really important. And so the other thing I'll also add is like really understanding what is the expectation in terms of your role as an intern is huge, right? And oftentimes we don't necessarily ask those questions, but I think particularly when you're getting feedback or having feedback sessions with like your senior resident or with your attending, I think it's really important to ask like, what are areas in which I can continue to improve on? Are there any goals or expectations that you feel like I should be working on? And I think being willing to engage in constructive feedback is really huge. I think a lot of times we shy away from that because, any type of feedback that isn't positive, you think of it as like, incredibly negative. It's, failure, et cetera, but it's not. And I think being willing to come to the table and asking for feedback, I think often is a very positive thing in a lot of folks' minds and viewpoints. And I think often will facilitate a very positive relationship with your senior resident, with your faculty, your attending. And so I do highly encourage seeking feedback. I think that's really huge. And also team mindedness as you navigate your role as an intern.
The teamwork piece is huge. And there's small things you can do. It's not like as a medical student where you're just kind of, what else can I do to help out? Just vaguely. Your time is valuable. You don't have much of it. And so what I recommend is there's some days that you may not have an appointment or somewhere to be after your shift. And that's when you look to your co-interns, your residents, and you see, okay, they're drowning. They just got to do admit. What can I do to help you? Because there's going to be some other days where you've got to be out the door. You got to make it to Orange Theory. You got to go do a Peloton ride. You cannot stay, but you've already helped out. So they already have that mental like, oh yeah, Bradley, oh, he's a team player. He's not that smart, but man, he is super helpful. And you start gaining that goodwill and that trust because sometimes you honestly just can't stay and help out. It's not getting abused or overworked, but every now and then there is key opportunities to really chip in and lift the whole team.
Yeah, absolutely. Thank you both for sharing. So with residency comes long hours, difficult patients, maybe emotionally heavy cases. How do you realistically maintain your mental and physical health in residency?
Realistically, I love that that part because it's hard. It really is. Because the way I navigate my mental and physical health, well-being now is very different than residency. I would say for me, I hinted about this earlier. It really was seeking kind of like support from people that love me, and so like my partner, my husband, my family. I still call my mom. I'm like, I had a hard day. Let me tell you about it. Like just get that support from my mom and also just like close friends. I think in terms of kind of emotional and mental, I always feel like I always really valued just being very mindful, taking moments to just kind of rest was really key for me. And then when I had the ability and even the time, engaging in physical activity as well. So I did like to work out. I didn't have a lot of time in intern year. I will not lie. I probably worked out like twice, if at all. But second and third year, there was a little bit more flexibility in my schedule and got to know the area in which I lived. So went and, found a really cheap gym and was able to join there for a really cheap, fee in terms of membership and got to know folks there. So that was really helpful. I will also say like sometimes it's nice to kind of have like a certain like if you're goal oriented and knowing that you're going through the trenches of like, a really tough block, like knowing there's a goal at the end, setting a goal for you can really help in terms of navigating that space. So like one huge goal for me was planning my wedding because intern year was so hard. And so I was like, my only happy space was when I was like pulling out my wedding book and like planning things or, watching like TLC and watching like the wedding shows or whatnot. So like just finding those small little goals for you to like help you get through the hard stuff was really huge for me. So that's, again, some of the mindfulness stuff that I did.
Yeah, mine was a community. I was really fortunate to have a really some really good friends in residency. We were just texting our residency group chat this afternoon, actually. And some people say like, don't talk about work outside of work. For me, it was the opposite because if there was a difficult or challenging case, I got to bounce that off of those classmates that also didn't mind talking about work. And I say, what would you have done in this situation? Or this happened to me. We were a very open and sharing group. I had an attending who was a little racist. Like she called me bro all day up in
Mhm.
Evanston. Um, I put in a spinal. She said, "Whoop, there it is." It was some weird kind of behaviors like that, and I was able to go to my group like, "Hey, does Dr. So and so? She call you bro?" And they're like, "No, dude, that sounds weird, man. I don't think that's right." But that was how close we were as a class, and that's really what got me through because I was pretty far away from family. Um, Even working through that bad relationship, the first I think year, 2 years of residency, they helped me get through that as well. So I know some people, it's either like spend a lot of time with their coworkers, and some people are like, I don't want to see my coworkers outside of work. Whatever it is that works for you, and whether it's family, friends, coworkers, you have to have that support network that can get you through all these difficult times.
I do want to put my APD hat on just for 1 second and also mention, like everyone kind of adjusts and adapts differently to the challenges of residency, right? And so um, I think it's really important to know like when to seek help. So if you are having like, mental challenges, health issues, being vulnerable enough, willing enough to reach out for help. A lot of institutions, a lot of hospitals have employee assistant programs, and so those are there in place for you to, seek mental health support, whatever that may be. So utilize those resources. I think there's a greater breadth and diversity of resources for mental health now than there were, I think, when we were in training early on. Telehealth and virtual platforms as well too. So I just want to put in a plug for it. Don't Yes, it's very important to have community. Yes, it's very important to have mindfulness and opportunities to connect with folks and support yourself. But it's also important to recognize, like, if I need more than that, it is okay. And that is not a bad thing to reach out and seek more help to support your mental health and well-being.
Absolutely. Thank you both for your candor, and thank you as well, Dr. Anani, for adding that nugget. So my next question that I have is, we foster these relationships throughout medical school and beyond. So in residency, oftentimes you and your friends part ways because you match at different programs, different states, institutions, what have you. So how do you maintain those relationships while navigating your busy schedules that each of you have?
So I will say for me, I feel like my true friends understood like the kind of change that I had in terms of my work schedule, right? I feel like your true friends will kind of adapt and understand that you're in this season of your life right now, and that's okay. Similar to different seasons that they may be in their life too. But the goal is it's not necessarily about the frequency, but it's the quality of time that you have with those
Mm.
friends. So I just made sure that anytime I was back in town at home, like I connected with my two best friends as often as I could, or as for as long as I could during my like vacation, or touching base with folks on the phone. I will say social media was kind of growing, so that was a lot of a way for me to connect with folks too, was through kind of social media platforms as well too. um, but yeah, I think it ebbs and flows, it changes, right? And then some of the friends that you may have had may not necessarily stay those same type of friends later in your life, and adapting to that too, right? That's just part of life. But I truly feel like your true friends, lifelong friends, they understand the season that you're in, and they adapt with that, as you would with them as well. So I was appreciative of that.
Yeah, I think it's an odd thing that happens with us in medicine because we go from college, we have a friend group, then we go to medical school,
Mhm.
friend group, residency, we have friend groups, and my wife's like, how do you know all these random friends from like late in your life? And
Mhm.
it's just the fact of of how we were trained in our different cohorts. The people obviously later on, our medical school classmates, they all understand the schedule, and those relationships ebb and flow. Family members, they may take a conversation or two. They still may not get it. My mom still doesn't come to me for medical advice. But when I have that time to be with them, try to make that, exclusive, and I'm not, otherwise distracted. I am in the moment. My friends from Howard, we had a small group of 10 people. I was really close in touch with 3 or 4 of the people out of the 10 in my small group. And back in January, when we were just in Mexico together, I think about 6 or 7 of us went and got together and hung out, got to enjoy the other side of this life that we've worked so hard for. So those friendships are always there. Once you get through intern year, each month may be different. You may have a very busy rotation in the ICU. You may go to ambulatory or something where you have more time. And definitely residency will end one day, and you can pick back up where you left off with a lot of those relationships.
Absolutely. Dr. Nani, did you have something else to add?
Oh, no, I was just I co-sign all of that. I agree. I think intentionality is important. And I definitely co-sign the kind of med school like reunion and vacations. They're the best.
I love that.
Say weddings are great. They're going to get married.
That's awesome. And so as fourth year medical students will be transitioning to intern year, what are some habits, in your opinion, early on in residency that set people up for long-term success?
Do you want to start? I'm happy.
Yeah, I'll start.
Okay.
And this is something I'm not good at, but systems, and planning ahead, having a way, like whether you're making a presentation that's due in a week or two to teach your classmates, whether it's day-to-day workflow and developing differential diagnosis. So I would always plug the Medscape app, which was, I'm sure now there's like ChatGPT, but the app with Medscape, it was like, there used to be a separate Hippocrates, I think was a pharmacy app. And then there was Up to Date, but Medscape had all of that and it was free. So it's the difference of, you have a patient that you've diagnosed in the ER and you're going to go to your senior resident for help, but you can just jump into the Medscape app really quick and get a good update on what you should be looking for, what tests you should run. You kind of you do this extra work. It takes 2 minutes, but if you stop and do the 2 minutes, now you're set up really well to succeed. Now there's, obviously artificial intelligence and large language models that can help you do that, but you'd be surprised, like the people that don't take that 2 minutes to briefly read about something, but will go to that senior resident or that attending and just not know and fumble through things. So taking that extra step, developing that system that before I go talk to them, I'm going to look it up myself, because there's so many questions. I had a student shadowing me the other day. He's like, he was a college student. He's like, what's a debridement? And it was a very busy day. I was like, dude, you got Google on your phone, man. You got to Google that word, and then we can talk about it. But have a system in place where you set yourself up for success. Take that extra time to actually use the tools and resources that you have at your disposal.
No, I completely agree. I think knowing your resources and having reliable resources is key. I know I agree with like the utilization of AI. I think open evidence is one that I know a lot of folks will use and actually cites the sources. So it's not like ChatGPT where like it'll hallucinate like all the time. You're not sure if that's actually real or not. I would not advise using ChatGPT for looking up stuff on rounds, but open evidence is fairly good and will give you actual medical literature to cite. I also think it's really important to, figure out, I like that the word systems, but like figuring out a system for yourself in terms of organizing your task. One thing that I learned is I like to create like checklists when I'm in residency, and particularly on nights. So I had a particular way that I would fold my paper and how I would organize my patients on the list. And I used a color-coded pen Like I would have those multiple colors. I still to this day, I have like 5 of them in my backpack right now. That habit has lasted me through my entire career. But like color coding, like green is for labs, red is for, to-dos, like, or green is to check off things. Red is for to-dos, like blue was for X, Y, and Z and, whatnot. And that was my system. So creating a system that works for you to help navigate your task, organize your task so that you can work efficiently and properly, I think is huge. And that takes some trial and error of figuring it out. And also like seeking advice from other folks too. Like, reaching out to your co-interns, like how do you organize your patient list? Like how does that work? Or what shortcuts do you know in terms of, utilizing, dot phrases or whatnot, if you have like Epic or something like that. But yeah, like just figuring out those systems that work for you to kind of organize yourself so that you can do the tasks that you have set forth for you on the job.
Absolutely. And I love the color coordination. I might have to adapt that.
It's huge. It's life-changing.
And the paper folding, the paper folding is
right.
Clutch. That's awesome. And so now both of you are fellowship trained. And so my question to you both is, when should interns start thinking about fellowship, research, or just long-term goals beyond the residency training?
So that's a great question. I would say that's where you have to know kind of the timeline of fellowship and how that aligns with your own personal timeline. So once you've actually discovered like what your area of interest is and you do want to pursue fellowship, I think it's really important to seek mentorship early. So talking to like, some of your faculty advisors, some of the attendings that you may have worked with and say, I'm interested in specialty. Let me understand a little bit more of what the timeline is. We as like, from a program leadership standpoint, will meet like with all of the residents like every 6 months. And part of our like checklist is asking like, are you interested in fellowship? If so, let's talk about timeline. Just so you know that. So for pediatrics, everyone like fellowships, if you're trying to apply and start right after residency, usually you're applying during your 3rd year. So you're kind of preparing towards like the latter end of your 2nd year in terms of letters and your ERAS application. And then the ERAS opens like July of your 3rd year to apply for fellowships. But that timeline may not necessarily be your timeline. Like I've had other folks who have, decided that, I don't want to necessarily apply for fellowship right now, maybe because it doesn't align with what's going on in my life with my partner, et cetera, in terms of move, or I'm not necessarily sure about if I want to pursue that right now. Maybe I want to give myself another year or two. That's completely fine too. But just understanding your timeline and then also the timeline of fellowship will help you kind of figure out when you should be starting that process. But for kind of typical pathway in pediatrics straight into fellowship, typically you're thinking about career planning the latter half of your 2nd year and then applying early 3rd year.
Mm-hmm.
Yeah, mentorship is key, like Dr. Nani mentioned, and it depends. Your mentor can tell you how competitive specialties, subspecialties are. For anesthesia, a lot of our subspecialties have become much less competitive over the years because people are electing to just go be a general anesthesiologist because the reimbursements are doing really well right now. One thing, if you're interested in subspecialty training, it's very helpful, I found, to start going to some of those smaller conferences. Once you start to kind of break out into different subspecialties, you may be a little surprised at how small, quote unquote, that annual conference may be. And you can really start to build good connections with, if you want to be a pediatric anesthesiologist, you can go to a conference that has the majority of pediatric anesthesiologists, because that's who you're going to be applying to for fellowships, and you can really start to rub elbows with those folks and network. But mentorship is key. Your mentor can also kind of break down, because one thing I encourage people to think about is we're exposed to academic medicine, and what a specialty or subspecialty is like in academic medicine. Sometimes it's harder to know what that subspecialty looks like outside of academic medicine. Mm-hmm. Are you potentially pigeonholing yourself into your triple fellowship trained, that you can only work at the elite of the elite institution to really leverage all of those trainings? Or did you want this other subspecialty that's very useful and applicable in a community hospital setting, because that may be something in your future. But a good mentor can help you navigate all of those and answer those questions.
Mhm.
Absolutely. Thank you. Dr. Nani, we have a question in the chat specifically for you that reads, what stands out to you in pediatric residency applicants?
So to be honest, I think some of the things that stand out are really not so much the like metrics per se, just because I'll be honest, pediatrics is not a hugely competitive like specialty. That being said, if you are applying to like some of the like top tier programs, yes, having that kind of resume with like community service, leadership activities, having some research exposure does not have to result in you having to do papers or anything like that. But I think having commitment and activities that you're doing is huge. I think I place a lot of weight on community service and leadership activities, knowing that you're really invested in kind of the work that you're doing and have shown that commitment over time. I think the dedication that you have to pediatrics, you want that to come forth, particularly in your personal statement and the letters of recommendation that you have. And then I also look at like certain attributes and things that I like to see. I'm a huge proponent. I already mentioned team mindedness. So I really want to be able to see that if I can. Folks who carry like a growth mindset, this idea of like, I'm continually growing, I'm flexible, adaptable, responsive to feedback. Those are probably the kind of top two things that I think about a lot. But yeah, like I think it's really about the whole picture. I'm not focused on grades as much. I'm not focused on, board scores. I really am wanting to know that you are a good human, that you really care about kids, and that you really want to dedicate yourself to being the best pediatrician that you can be. But I recognize that's me and of one. But that's something that I believe in. That's also shared with my team as well.
Thank you for answering that. I know we are a bit short on time. I just want to ask one more question, or two questions and combine it into one, if that's okay. So the question is, if you could give one survival tip for intern year, what would it be? And what advice would you give your medical student self?
Yeah, I can go briefly. So survival tip, take an extra 30 minutes to an hour one day and just go physically to whatever hospital you'll be working at. Maybe it's multiple, and just walk around and learn the lay of the land. The environmental service workers, chances are they're probably going to look like me. I don't know what you look like on the side of your screen, but you may identify with them. They can be your support network as well, but physically learn the layout of your hospital. That can definitely help. And then the advice from my younger self. So I took out a private relocation loan. It was through Wells Fargo, and I didn't know how much I'd need to move. So I went and I got like a $3,000 loan. It was actually really easy. It comes with like an origination fee. Well, I needed more money. So I went back and got like a $4,000 loan. I ended up getting, I think, a total of like $15,000. And each time I was getting charged like another origination fee. So I think in retrospect, I would sit down and actually figure out how much money do I need to budget, and then approach, taking out that loan, or whether you go fund me or look at other family and friends. Budgeting could really help.
I think one good survival tip, I do like the idea of kind of preparing before like the next rotation for me. And this is one that I still kind of implement to this day, is like reading up on the patients beforehand, particularly for like an inpatient service rotation. It's really important to like, I think it just makes the transition a little bit easier. Like you'll get sign out from your co-resident, but it is helpful to kind of sit down, and particularly if you have remote access to the EMR, like at home, just to take like the 45 minutes just to review the list and just get a sense of like, okay, what are the active things going on with my patients, so that when I come in day one, like you're already going to hit the, payment running, like trying to navigate, new patients, who knows if they're new admissions, but at least you have like a good foundation coming in, or at least awareness, I think is really key and just helps for that kind of initial first day. The advice I would give myself is give yourself grace. Like it is okay. Like, I mean, truly, like you will be okay. And like, again, goes back to the beginning of like, you deserve to be here. You have all the skills and capabilities to be here. Just understand that you're going to continue to grow and learn. And I think when you have that self-compassion and that self-love for yourself, and it changes your whole mindset in terms of the experience of residency, the experience of learning on the job. When you just give yourself grace and allow yourself to be okay and know that like mistakes will be happen, but there are systems in place, one, to ensure patient safety, but two, to allow for you to grow as a clinician. And that's something that we do kind of throughout our careers.
Absolutely. Thank you both so much for your insight, your encouragement to our newly matched fourth year medical students. We really appreciate your time and just the knowledge that you've bestowed on us. I know I'm an MS3, but I feel like I've learned a lot moving forward. So thank you. And thank you for everyone who watched this panel, and congratulations to our newly matched fourth year students. You guys did it. So with that, I bid you adieu and hope you all have a good evening.
Thank you.
Thanks. Congratulations.
Congrats.